Hello, this is Mark L. White with Dr. Tasmin Cordie. How are you, Dr. Cordie?
Hi, Mark. I'm great today. Thank you. How are you?
I'm doing awesome. And you
Good.
join us. You're up in New Jersey, New York.
New Jersey, Central Jersey, near Freehold.
Awesome. And I know that you're into integrative medicine. You're a nutritionist and a healer. Um, but one thing I've learned recently is you're also passionate about helping people with prostate and breast cancer.
hmm Yeah, my initial or kind of my first degree is as a chiropractor, and then early on in chiropractic school, I started with applied kinesiology training.
Mhm.
Chiropractic alone didn't feel great for me, just getting adjusted, and I needed more, and kinesiology really offered that. And so in practice now, I'm definitely a muscle tester, and I end up taking care of a lot of patients with hormone dysfunction and imbalance. And a lot of people are
Mhm.
interested now in hormone replacement. And so with all the training that I've done, I really help them make sure that the hormone replacement that they're on is being well tested and well tracked. And that definitely goes goes toward making sure that they're preventing breast and prostate cancer, because sometimes people are being well supported but not well detoxed,
Mhm.
and we need to kind of see that cycle on both ends happen really well, and it doesn't always get checked really well on both ends.
It's first of all, I think it's interesting to me to hear a chiropractor talking about looking at cancer and also hormone replacement therapy. So, natural question is, how did you get into HRT and what was the impetus for that?
You know, really, I've been in practice for 20 years, and so about the first couple years of practice, I did pretty traditional chiropractic, and I really got just sick of seeing the same neck pain and the same back pain come in on a weekly, biweekly, monthly basis. And it happened quickly for me. It just wasn't terribly fulfilling to do that same thing. Like, I'm certainly a kinesthetic healer, and I love touching my patients and helping them heal through that. Um, and and so I really needed to transition my practice into something that was more stimulating for me. And I ended up getting back into kinesiology, and I use a technique in practice called nutrition response testing that got me back into doing really a more holistic and foundational nutrition approach to taking care of patients. And with that, I end up having a practice that takes care of all kinds of things. And so when friends or people ask me about what kind of people I help in practice, it's sort of like a general practice. It's like a primary care kind of practice. It's just that I'm not giving sinus medication. I'm handling
Mhm.
it from a grassroots effort. But I'll see all kinds of things. And what's surfaced, especially more recently, is a lot of people with hormone dysfunction. And it may be the area I'm in, they're getting supported with hormones. It may be the area I'm in that they have more problems with it, but I've just seen more and more of that more recently. And I think what we're interested in, we tend to attract. And I'm
Mhm.
definitely interested in helping people prevent cancer in a hormone balancing way. And so over the last, I guess, 7 or 8 years, I've got my certificate in functional medicine, and then also my diplomate in anti-aging through A4M. And so that those two like sources of information and continued education, they do such a good job of teaching and training for bioidentical hormone replacement and why and how to test for those things and how to balance those. And so I feel like I have a really good foundation of helping people improve
Mhm.
their health, but also understanding how they can show up to that in a prescription level way. I'm not a prescribing physician, so I get to work with a lot of other practitioners to help patients get their best health handed to them.
Excellent. Excellent. Let me ask you on, because you mentioned that you focus on breast cancer, you focus on prostate cancer, and there's a lot of, I want to use the word misconception, but there's these beliefs that the testosterone actually causes or stimulates prostate cancer and BHRT in women stimulate breast cancer. But what's the reality?
The reality is that the pathways that our body uses to detoxify hormones in general are usually pushing those hormones in the wrong directions, and they're not cleaning them out very well. And that's really the concern when it comes to cancers. And poor estrogen detox pathways are really our concern with both estrogen driven breast cancers, but definitely with prostate cancer also. And we never even think about, generally speaking, we never think about prostate cancer being linked to estrogen, but that's really what it is an estrogen detox issue. Because once testosterone trickles down into its pathways, the next thing that happens is it aromatizes to estrogen, and we need to make sure we clean that out. And that's usually the imbalance, is not the testosterone. In fact, when we have healthy levels of testosterone, that's protective for men against prostate cancer rather than supportive into those problems.
So generally, it sounds like if somebody's doing hormones incorrectly, that can lead into trouble. And you're starting to see a like a whole blossoming of these online testosterone clinics and hormone clinics. Are they all doing like what would somebody like myself look for when we're just trying to decide where should we go for testosterone?
So I think more and more we're seeing the need for it be recognized, which I think is great. The problem is we're not following through and making sure when we're giving that to you, you're processing it properly. Because if it's an exogenous source, an external source, we need some support in cleaning that out. The body's not producing it. It doesn't know how to get rid of it either naturally. And so we need to follow through and do a couple different kinds of tests. We can do a urine metabolites test that looks at how the body processes those out. And we also need to be looking at labs on a regular basis. If testosterone is injected, which it's commonly injected, right, on like a weekly or biweekly basis, we can take a look at those levels in serum, kind of the typical LabCorp or Quest labs that we can get. But if you're using a topical testosterone, like a cream, and a lot of times it's rubbed on the back of the arm, just to lessen the transfer to family members. And that cream needs to be tested not in blood serum levels, but it needs to be tested in a couple different ways, either saliva or urine levels, because it's a tissue level. When we put it on the skin, it doesn't get into the bloodstream the same way as like an injection does. And so it's just a proper way of testing those things. Can I give you an example of someone I just met yesterday? He is doing testosterone injections and has been for a while, but no one's ever checked these detox pathways. And so that's sort of our next step. And the problem that starts to happen if they're being overdosed at all, and they're not, or they just don't have good detox pathways, is that now he's starting to develop some prostate symptoms and sort of more or frequent hair loss symptoms. And that may mean a couple of things for us, that we may be pushing him down kind of unhealthy or more aggressive testosterone pathways that would cause those things. And we just need to see what's happening. And it's really felt better for him to take testosterone. But there are other things that are starting to creep up in his symptom patterns that look like it may not be either the right dose, or he needs some support cleaning these pathways out.
So when somebody's looking at their blood work, are you looking more at total serum or free serum? And what's the proper, like, where would you say this person needs to be on testosterone? What's the optimal amount?
So I think we need to look at both total and then free. And usually the total is the most common number to look at. We kind of have this range between like 300 and 800 or 300 and 1,000. It sort of depends on the lab you're looking at. But typically around 600, 700 is where most men will say they feel pretty good. Okay,
and then for estrogen levels, do you usually recommend an anti-aromatase for men, like something to block the conversion of testosterone to estrogen?
Yeah, we can. The two most common things that we usually say, well, I guess three most common things are saw palmetto. That's a really common one that comes up with prostate health, right? Because it blocks that aromatization. and that causes the estrogen problems. Resveratrol is a nice one that also just helps balance testosterone levels. And then nettles, and nettles will come in two versions. It'll come in the nettles, like the leafy parts or the aerial parts on top, and then the nettle root. And the way I remember how to use nettles with sex hormone balancing issues, especially with testosterone, is that the root is on the bottom. And so the root is the one we want to take to help balance testosterone levels. And then the aerial parts are usually for the lungs and the upper respiratory system.
I've never heard of nettles before. That's really cool.
Okay.
That's neat. And what else are you doing? Anything? Are you working with patients that are taking peptides or?
I don't work with peptides at all. You know, it's because I'm a non-prescribing physician, even bioidentical hormones is generally out of my scope, but I understand how to use them. I've done the training, so I understand how to help patients ask for better monitoring or ask for different scripts if that needs to go up or down, or really just different kinds of products used when they are prescribed things. But, you know, peptides I've kind of just kept my hands out of it. I think it's a really interesting part of healthcare that seems remarkably safe and really effective, but I just haven't done much with it myself.
And you work with a lot of women as well that balance their hormones, like a lot of bioidentical hormones?
I do. My practice has always been probably 70% women, 30% men. That's pretty typical for me. And most of my patients are in the kind of the 30 to 60-year-old range. And so they're either cycling or perimenopausal or kind of newly into menopause. And that seems how this practice is looking right now. It's just about a year old since I started this practice in New Jersey. And so a lot of those patients, that subset of patients, tend to need hormone testing because a lot of them are coming in with such dominant symptoms of stress, and that affects the sex hormone system so much. Stress and cortisol tend to really push the thyroid in the wrong direction, push the balance of sex hormones in the wrong direction. And so it tends to be a really complicated picture with both thyroid and ovaries and adrenals and liver, and all these things get really clogged up. And so kind of teasing those out a lot of times is really helpful. We can see where estrogen, progesterone, testosterone are, and then eventually looking at thyroid hormones. And that might be even first, that may be the reason they came in, is thyroid stuff, because they were diagnosed with a hypothyroid. Which may ultimately be a hormone problem and not a thyroid issue.
Well, earlier we were talking about cancer and specifically breast cancer, prostate cancer. And I assume that you get a lot of people that are looking for alternative ways to either prevent or treat cancer as opposed to chemotherapy or so what advice could you give our viewers out there? Like, what should we be doing to either prevent cancers, or what's the biggest thing that you're seeing right now? Any trends?
So I think fortunately with breast cancer or breast screening, we have a lot of really good tests that are very accessible. A lot of offices or alternative healthcare kinds of offices or integrative healthcare offices will offer thermography to look at of the health of the breast tissue. Thermography, can also be used for full body scans to note areas of inflammation or problems. The other thing we can do on a regular basis is breast ultrasounds. And we're not giving you any radiation with an ultrasound. It tends to be a very non-invasive way to look at the tissue. It's really quick. They're read by radiologists. In fact, a week from today, I have a company who comes into my practice and does just breast ultrasounds for the day. It's separate from, but we just host them because sometimes gynecologists are hesitant to order ultrasounds if women haven't had a mammogram first. That's obviously the entry point in traditional healthcare right now is mammograms. But I have a population of patients in my practice, and a lot of colleagues who do the kind of work that I do are the same way, that a lot of our patients would rather not get the radiation exposure to that sensitive breast tissue. And so they still want to screen, and it's really important to screen, particularly if you have a high genetic risk for breast cancer, like a BRCA or a few of the other gene markers that we know are particularly high risk for breast cancer. And ultrasound is a really nice way to do that. And so I would start there. We can look at specific markers in the blood, but those are really accessible ways to get the breast tissue looked at on a regular basis and fairly inexpensive. I know the company that does the scans that we'll host next week, it's less than $300 for the ultrasound test to get it read by a radiologist. And it's so non-invasive and just painlessly easy. It's really worth it.
Do you have a lot of patients that are working with you on nutrition or lifestyle modifications? People have cancers, and have you seen great response with certain nutritional interventions?
I don't have patients who show up who are working on active cancers very often. That population tends to not show up in my integrated practice for sure. I've had a few, and I've certainly have plenty of patients in my practice now who have a history of some kind of cancer. And usually I think that's because when you're going through a traditional oncologist to treat or to handle cancer, the oncologist tends to be pretty certain about what they will allow their patients to do. And I think that's fine. There are certainly some really successful integrative practices that handle cancer specifically, but that's not my practice. I usually help patients after they've been through it or while they're going through it, sort of with the blessing of the oncologist. But I'm definitely not the primary mover in that kind of circumstance.
Great. No, it sounds like the people you work with are people who just are dedicated to staying healthy.
So much so, I think I'm dedicated to staying healthy, but a lot of times they just haven't found answers in other places that are traditional. If they've gone to their endocrinologist or their primary care, their gynecologist, they've gotten answers that either didn't work for them very well or didn't feel very good to them, or just simply haven't gotten a very good answer at all. And they end up here as a little bit of unfortunately a last result, or just the next thing. But it's oftentimes not the first line of defense in figuring out their health. And I really have said this forever, that the patients who I attract in my practice are really dedicated to taking responsibility for their health, and they make a lot of changes. I can't go home with them and make the changes for them. Like, I can't make their dinner for them. I can't put them to bed on time. I can't turn the lights out. I can't fix their toxic relationships. But very clearly, my patients wholly see how important all those things are and really show up in a way that I've always been impressed by, how much they're willing to change to improve their health.
What are you most excited about? I see that you're doing a lot with LED therapy and energy therapy.
So one of the, in addition to the functional medicine or the integrated part of my practice, we just got an aerolase laser, which is really fun. I'm so used to having patients come into my practice for things that, my conversation with them sounds something like, well, in the next 6 months, we're going to start to see changes. It takes a long time to really move the needle on some of these symptoms that, we have high liver enzymes, we've got cholesterol and lipid values completely out of whack. We've got hormones all over the place. Like, these things are so spiderwebby. It takes a really long time to tick away at all of the things that make them up and really start to change their symptomatology pattern, but also change the data in the lab work. And so with this laser, we can use it for kind of medical level things like psoriasis and eczema and acne and scarring, things like that. But we can also use it for like wrinkles and little sunspots and more superficial aesthetic things. And it's fun because it's such an immediate gratification. And again, in contrast to what how I've practiced and the rest of how my practice is, it's a kind of a nice fluffy thing to be able to do, although it really makes some profound differences for some patients who have like really, big, deep acne scarring and active infections and other things, like little things, even like warts and toenail fungus. But it's
Also with
just a
toenail
big
fungus,
contrast to, yeah.
a little bit of everything. Well, that's exciting. So what's next for you? Like where do you want to take your practice over the next 3 to 5 years?
Well, I would like it to stay here. And I say that kind of tongue in cheek because I'm a little bit of a gypsy. I've moved in a lot of places. I've started several practices and I really like New Jersey. And I like being where I am. So I really want to be here in 3 to 5 years. I'd love to just be in the same space. We just moved in about a year ago and are kind of comfortable and set. I have a really nice new physician's assistant who's working with us, who has a lot of experience doing different kinds of injections for neuropathy and knee injections and some aesthetics. And so it's just a little bit of a different area of practice that I'm figuring out how to do well with, like working alongside, because I'm not an injector. And so it's so much for me to learn that part of regenerative medicine. So I'd really like to be able to stabilize and support that part of the practice kind of in connection or combination with what I can do with neuropathy and other musculoskeletal concerns as it relates to just being a chiropractor.
Are you seeing anything, or is there anything that you're working on when it comes to regenerative therapy, such as stem cells or anything like that?
We use PRP in our practice, so so we don't use stem cells for no particular reason except that PRP is accessible, the price point is really accessible, and if we're using it well and right, it's really, really effective. We can use it for so many different things, and again, it's an easy explanation for patients to step into using kind of their own stem cells rather than where do these other things come from. Stem cell therapy is amazingly effective. It's just not something I choose to have in this practice right now.
Okay, yeah, because I've been reading a lot about exosomes and stem cells, and we've seen a lot, and a lot of people believe that's going to be big. But that's exciting. You've been in New Jersey now for just a year, and
in this
really building it
practice
up.
for a year. I moved here a few years ago for a functional medicine practice that has sort of shifted, and I've been really lucky to work with a chiropractic office for the last few years that I've kind of transitioned out of and into my own practice again. And so I still get to do some adjusting at that practice a few days a week. It's a very busy upper cervical practice. So I'm really lucky, like I get my own world and then I get to step into sort of the milieu of a really busy upper cervical practice that we get to see a lot of patients do really well there. It's a big maintenance practice. And so it's just a fun place to be with other doctors and a really good, well-established practice. So it's a fun place to sort of play chiropractic once a week. And then I get to come back to my own space and do this other stuff.
I think if you're a gypsy though, you must be excited about like the advances in telehealth, because you can be anywhere helping anyone.
I lived in Boulder, Colorado for 5 years. And when I left there, I sort of brought my practice with me. And I had always taken care of my patients from remotely, I'll say, since leaving Pennsylvania, which was the place I was before that. I had kind of a small subset of patients who just kept asking for my help. And so I sort of had a telemedicine practice before it was popular on a really small level. And when I left Boulder, that whole practice just sort of came with me, and it was really nice because I had some liberty to be a little bit free for a few years, which felt really good in terms of not having a brick and mortar. But I will be clear and honest that I really missed having a space for my patients to show up to in a practice, like to provide a space for them, and I really missed that. So I'm glad to have that back again. Although I still have plenty of my practice, which is still telemedicine. So I get a little bit of everything, and the variety is good for me. Yes.
So if anybody wants to reach out to you, you can treat via telehealth or in person if they go to New Jersey. It's tasmincordie.com is the best place.
Yep, it's just my full name.com, and our office information's on there, and they can click through just for kind of a free phone consult to check in and see if what's happening with them is a good place for me to start with them, or if they need to be referred somewhere else, we can figure that out. But for the most part, we can start there and then start helping them get better. Yeah.
Okay, great. And we'll have that in the show notes. Dr. Cordie, thank you so much for your time. I really appreciate it.
Thanks, Mark. Have a great rest of your day. Thanks for having me.
You too.